Okay, so preemptively, I already primed my tubing, okay? Just like if we were setting up for an A-line, right? Right now, we just need transducers so that it can translate the pressure, okay? So my 500cc NS bag, okay? Making sure that we're inflated till we see the green, okay? Make sure that we prime our tubing. When we're priming our tubing, make sure that you also prime the stopcock, okay? There should be no air, okay, in any of the exit points, okay? Please make sure that your connections are tight, all right? Everything that you will need will be coming from the kit, okay? You're going to have your cable, which gets connected to the monitor. You're going to have the two of the cables that get connected to the monitor as well. Your stand to hold your transducers, your pressure guides, and your NS fluids, and your transducers, okay? So everything is in that kit that you need, all right? The brown port, which connects to the pulmonary catheter, okay, obviously goes to the brown. We have our red catheter, just like again, if we were connecting for an A line, and we'll need that second one for the CVP, okay? So I'm gonna get my second one, and I'm going to connect that. There are going to be a lot of cables here, okay? So make sure that you keep your head together and work slowly, okay? So I connected my catheters, my cables, all right? Brown, right, which is in the kit, and my two reds, one for the catheter and one for the CVP, okay? Now we're going to obviously make believe that the catheter is in the patient, all right? The catheter that I'm going to connect, all right, that brown connector that you found in the kit, all right, will be connected to this piece here. If you look inside, excuse me, if you look inside, okay, you'll see that you want it to match. You should not be forcing it in, okay? Do not force it in. You should see a little groove, okay, a little groove on the cable, and you want to align that groove, and you notice all you have to do then is just twist it and secure, okay? You should not have to put pressure. You don't want to break those the cable on the inside, okay? All right, so that connects our port. All right, then we have our two other, so just think of it again like if this is an A line, right? We have our two transducers here, whichever one you choose to connect. Just make sure that you label appropriately. Always when you are receiving your patient, you should trace all your tubings. This should have been primed, okay? And making sure that there's absolutely no air and that this is prime. I'm going to connect this one to my blue, and I'm going to connect the other to my distal, right? Making sure that I have a nice tight connection, okay? Make sure that it's tight so that it does not come loose. All right. Again, there's going to be a lot of cables. Just try to remain organized. Just if I was connecting for an A line, I have my two cables. I'm going to connect one for the pulmonary artery pressure, and I'm going to connect my other one for my CVP. And you should see now the waveform on the monitor, but we're still need to zero. Obviously, in this training environment, we have no waveforms, but we're going to make sure that we select the appropriate. This is already CVP, and this is pulmonary pressure. If I want to change it, we'll click on this and we'll change that label, okay? Pulmonary artery and our CVP. And obviously, if you have an A line, then that's what you would do as well, okay? If when I'm going to zero, it's going to be the same way, all right? Making sure that I am zeroing and having my transducers to plebistatic axis, meaning that the patient needs to be supine, and they do not have to be flat. They can be from 0 up to 60 degrees. We're going to hit, if I'm going to start with my pulmonary artery catheter, okay? Making sure that Take off my top, just like if it was an A-line. Okay, I go here. I'm going to 0, pressing 0. Once I see 0 on the monitor, I'm going to go back here. Like that. Making sure I have that open. I'm going to 0 my CVP. Go back here, select my label. 0 my CVP. Wait for that 0. We're good. And now we're gonna open it so I can get my reading. Okay, here we go.